Welcome back, guys, to the Unhinged Hygienist with Tasia.
And me and Lauren. What's up?
Where we, as you probably, if you've listened to our previous episodes, were a little mildly inappropriate, super highly opinionated, and still employed.
Somehow, honestly, every episode that we've been filming kind of quietly feels like an HR violation.
And yet, here we are.
Thank
doing the
goodness.
damn thing. We are doing it.
We're doing it to the best of our ability as authentically as possible. We are still licensed. We are still scaling teeth every day and still asking uncomfortable questions that nobody wants to talk about and nobody wants to ask. So, buckle up for today.
So, right, like the last episode, we may have ruffled a few feathers, I think. But...
By feathers. I mean, we're not wearing feathers. We don't tickle feathers. But basically, what she means is a lot of offices are just calling disease just a cleaning or a prophy. And I think we said something differently.
Right. Which is the shoe fits, right?
Yeah, it's true. The shoe fits, it's disease, people. Don't treat it like it's not. So today, Tasia and I, our goal is to ask each one of you out there in listening land, all right, tell us what it is that you, the hygienist, actually do. And we're going to tell you what we do. Yeah. We're going to walk you through a nice routine. This is going to be great for people who don't have hygienists like us, because I think this is going to hopefully elevate what they're going to look for in their practice. So what do we do, Tasia? What do we do?
Well, despite popular belief, we do not spend our days gossiping and polishing teeth. And we definitely know that me and Lauren don't polish teeth because we are,
GBT certified, airflow in the house. Oh, it's still funny when people are like, aren't you going to clean my teeth? Where's the spinny thing? And I'm like, have you looked at your teeth? Let me give you the mirror. Those babies are clean.
And the funny thing is I explained the whole process to them. And again, at the end, they're like, but you didn't polish. But I explained this whole thing to you that we don't polish anymore.
I don't think that
they're just used to it. It's been and that's all we had for so long. So,
That's a habit. My little tweak for when I first got into doing the airflow is when somebody would demand that I would polish their teeth, I would do it with toothpaste or MI paste or varnish or something that way they felt the little rubber cup and they felt like, ooh, but I wasn't damaging the pellicle because I was already trying to instill in them, I have completely made your teeth naked. So let me put some minerals back on. But sometimes people don't listen. So
but we are here to spread awareness.
That's true.
But today we're going to pull back the curtain on what airway and whole body focused hygiene really is, actually doing what we are actually doing during your whole appointment.
Yes, I'm glad because, spoiler alert, it is way more than scraping off tartar and us telling you to floss every time.
That's right.
So let's, Tasia, I want to start with one of the biggest misconceptions about hygienists and dentistry.
And I think you're going to hear us saying this a lot, not just in this episode, but many, but that we just clean teeth.
The number of times I think you and I and everybody listening have heard, I'm just here for my cleaning. I mean, come on.
And every hygienist listening right now, I think even myself just twitched a little bit.
Yeah.
I'm just here for cleaning. Hurry up, just clean my teeth.
Yeah, I came in late, but I need to be out early.
Yeah.
And just clean my teeth.
Yeah.
I actually had somebody this last week tell me that I didn't need to do my best job because she came late and needed to leave early. And I was like, oh, which teeth would you like me to ignore? So the disease process could just, yeah, exactly.
The ones that are hardest to reach.
Girl, I have had people tell me that. People have literally looked at me and said, don't clean the back ones. I can't see those anyway. And I'm like, oh, okay. All right. Well, so anyway, squirrel. So, I want to get back to the idea of us just being tooth cleaners, because if that's all we did, if all we did was just clean your little teeth, a very well-trained chimpanzee with an ultrasonic scaler could probably replace us. And we all know that's not true.
Touche. But with excellent ergonomics as well, I'm assuming.
Do you think we'd be better than the chimp? I mean, we can wear loops.
They could probably do some like upside down type.
Whoa,
They'd be
man, that
hanging
could be
off the
really
ceiling
good.
light, you know? That'd be-
For the upper anterior linguals, like that's really the hardest part. I don't care. I can't get my pure vac and do everything. And so,
It's
whatever.
hard. I
For
love
those of
direct
you that use the
vision.
relief, you know, I'm proud of you.
Yeah.
I never got into it,
I
but
have it.
I am an old school slow speed suction with my pure vac high vac. And
Yeah.
that's what I like.
Yeah.
I think it's great. I know, the new bird, I know people really like that one too. That one never, but hey, that's why I like temping because that's when I get to learn about all these new things. So anyway, all right. So cleaning, assessing, screening, educating, investigating, monitoring your health. That's what we do.
Yep.
That's what we do. We're not just looking at your teeth.
And we're constantly looking for patterns, red flags,
Mm,
what's going on, you know?
hmm Yeah.
Connecting those dots as we
That's
always
why we ask
do.
all those questions. Yeah. So I do you at the beginning ask a lot of these inquisitive questions and then people say, well, why are you asking me that? I'm just here for a cleaning.
Yeah.
Yeah.
Well, why are you
That's
taking my blood pressure? That has nothing to do with what I'm here for today. Well,
yeah. So I have a bullet point list in my brain of things that I think we go over that people don't necessarily understand. At every appointment, we are evaluating gum inflammation, your bleeding, bone loss, oral cancer risks, recession, cavities, dry mouth breathing, tongue posture, airway concerns, clenching and grinding, nutritional deficiencies, medication side effects. That's why we ask about your health history, people. And also is seeing if there is a touch of disordered breathing while you sleep.
but we just clean teeth, Lauren.
No. No, that's right. That's right. I step back. That's right. We just clean teeth. We just are the tooth janitors. All of that other stuff is just kind of what we do for fun.
And while we're doing all of this, it's a lot. Our brains do not stop,
Mm-hmm.
but we're also trying not to destroy our necks and bodies in the process. Because I'll tell
It's
you
true.
for myself, I do have the ergo loops, which have been life changing for
Yeah.
me.
Agreed.
But there's some days where I'm like,
Well, the days where you have to stand, like if I have one of my cute little old ladies who I can't lay all the way back, so now I'm not in my saddle stool, I'm not in my proper ergonomic position, and have you tried to wear ergo loops like this?
yes,
That's
because I stand, because our whole office is set up left handed.
no, I didn't know that.
And
How many
hopefully they'll
hygiene chairs
renovate
do you have?
soon. There's four, but it's just, it's the type where like the unit comes out. So like I can't really get around.
Oh, wow.
Oh Lord. Yeah, I
So
stand
we're
pretty
going to
much
have an
the whole
episode.
appointment.
I know there are some ergonomic queens out there. And
Hmm.
so I know I've taken some CE courses from some people that I think would be super fun to talk to for
Yeah.
people who do have to stand. Or what do we do in these instances, especially for new grads or old grads? I think we always need little refreshers about that stuff. But,
But yeah,
we're thinking about our own ergonomics and then we're thinking about what we're assessing and we're doing all this stuff all while we're still trying to make appropriate cute little expected small talk and it's like, oh, tell me about your family and your upcoming cruise and
all that
mm,
stuff.
mhm,
Yeah, but the average patient thinks we're just counting. We're counting gums, we're counting
mhm.
teeth. We're just go in there and clean and send us on our way, pretty much.
Yeah. And I think it's cute how many times we show somebody our perio probe because they're like, how are you measuring?
Yeah.
Where are you getting that number
Yeah.
from? And I'm like, allow me to show
Making it
you.
up in my head.
Exactly. I'm not just guessing. So,
Look at me while I
um,
lose the probe all the way down. I don't even know what number it is. 20 at this point? I'm not sure.
it's in the handle. You're like sideways and
But
backwards. So,
it's your normal, so it's okay. We'll watch
no,
it.
no, we're not going to watch disease, Tasia. We're
I
not watching disease progress. And this
I'm
is what I
not.
don't understand. We're literally measuring the support system that is holding your teeth into your head.
Yep.
No biggie. No biggie.
Just a minor detail though, right?
Is it
What's supporting?
important? Is it actually? I mean, who cares? Who cares how deep a pocket is? Who cares if it's bleeding, if it's pussy, if it's mobile, if there's full of recession, if it's generalized, whatever. We're not asking all these questions to be nosy people.
No.
We really, really want to know more about you.
Because your body, believe it or not, tells us why your mouth keeps having problems. And then your mouth and
What?
then your overall health.
That's amazing. It's a clue. It is genuinely a clue to tell us through your mouth because a lot of, especially if you've ever studied Oriental medicine, they use the tongue to tell a lot about what's going on. So we can see ahead of time, and we learned this in school. Like you were saying before, we can see diabetes, we can see pregnancy, we can see nutritional deficiencies, stuff like that. We can tell early what your body could be struggling with and help you get to your primary care physician or, make some lifestyle
We
changes.
can see if you got a new boyfriend whose oral hygiene might not be the same as yours.
Fun fact and PSA people, germs are transferable. Do not date anyone with a nasty mouth. Everywhere the mouth goes, so do the germs.
They do.
Ugh,
Gross, gross.
ugh, gross. If we ever petri dished the mouth before people started dating, I think the idea of French kissing would definitely go away.
So now you're going to bring me to the Boots, Bugs, and Biofilm conference
Ah,
right
ah.
after my divorce. Let's go do a course on like microscopes and pathogenic bacteria. And I was like, damn it.
Ew.
Like
You're like there.
there it goes. Like I can't go now to a bar now, just find some cute guy and be like, let's make out. No, I'm gonna be
Nope.
like, can you please spit in this vial? And I shall
I
get
need to
back to
send this
you
off.
in
I'll
about
let
three
you
to
know if we
five
can have a
days.
first date.
That's but I've literally pulled guys' lower lips down. I think I might have said this in another episode, and I was like, no, there is no way.
That's
I'm
hilarious.
not. Maybe
That's
we're hygienists, so I think coming from it's not as abnormal, but I don't know if the normal, just. But
I
I'm gonna
have
do it.
definitely asked people on a first date when their last cleaning was.
Oh, that's one of my
Yeah,
main questions.
it's important.
Yeah.
And, you have to know all that
Yeah.
stuff. But, you know.
But now let's break this down in some
Okay.
plain English.
Okay. Plain English. Here we go. What is the average appointment often looking like? What do the average people in the average office that don't have a non-average hygienist like us experiencing? We say, have there been any changes? Have there been any major medical changes? Are there any changes to your home care routine? All right, lay back, open wide, scrape, 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 floss, 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 spit, peace out, see you in a few months.
6 months.
Mm-hmm.
Use some mouthwash.
Yeah.
You know how
Improve
we feel
yourself.
about mouthwash. You shall learn, but
Certain mouthwashes. I am not anti-mouthwash.
no.
I'm anti-napalm. That's what I'm anti. Yeah.
And with all of that you said, there's also like the complimentary guilt trip of like, are you not flossing? You need to
Oh,
floss more.
oh. I like when they flossed in the car on the way. Yeah.
Floss cuts everywhere.
Yeah. You're like,
Trauma everywhere. Like,
exactly.
thank you for flossing, but just do it every day, not
Spread it out, man. Don't do it for
aggressively
5 minutes. Yeah,
before.
exactly. Yeah.
We can
it's true.
tell. We can always tell. Yeah.
That's true.
But a whole body focus hygienist is thinking, why? Like, why is that inflammation even there? Why is a person breathing through their mouth? Why are they exhausted? Like, why are they grinding their teeth into dust? And now I'm wondering why I haven't had a sleep test myself. Now I'm all these thoughts.
See? I'm glad. I'm glad that
Sometimes
you're
like we
thinking about
say
it.
this all the time to patients, and then it's like we almost like, and I talk about it, but then we get so busy, and then I just forget about myself.
Yeah.
I did
exactly.
get a CBCT scan last week, so I'm in the process of trying to
Excited.
get all that
I'm
done.
excited to see your measurements, see kind of what your airway is doing because it's data. And this is one of the things that I wish more offices were actually doing is taking a CBCT because you can get a lot of the information, especially if you're going to be more biological, if you want to be more holistic. We can see your root canals. We can look for what's called a cavitation, which are very interesting too. I just, why are we not taking the full picture? Because we are tooth sleuths. We are detectives. This is information for our case.
Yeah, there was one office I worked with in Vegas that every new patient had a CBCT scan, and it was great. Now, did they do what they should have along with that? Not so much, but at least they were in the right direction. But
That's true.
yeah,
That's true.
but we're detectives. We're very underappreciated detectives.
Is it the same as being a regular detective because we have our loops and we have our little sharp pointy sticks? I mean, is that kind of like Columbo? I don't know.
And just like you were saying, like your bullet points of everything you go through in an appointment, like I don't think people realize the amount of brain power that is happening like behind the scenes, like in our heads as we're evaluating
Yeah.
you in a short period of time, trying to understand everything and not overwhelming you.
And
Because
then
I
remember it
tend to
and then
talk
take
a lot,
appropriate notes.
and I know
Yeah.
you do
Oh,
too. So sometimes I have to like stop myself and be
yeah.
like, let them answer.
You're like, I already know the answer. It's coming. So, no, it's true. No, because we're asking a lot of questions and we have these ideas in our heads. And of course, being the tooth loose, being the detective, every single thing that we see in there is like clicking off little question marks. So, hopefully, there are people out there who have seen a hygienist who asks about their sleep, about their medications, about their stress levels. Are you breathing through your nose? What's your tongue posture? Have you ever even thought about your tongue posture? Tell us about your diet. Do you wake up with a dry mouth? Like, if you have had one or any or all of these questions, I say kudos and congratulations. Please tell all your friends and family to go to that hygienist.
And if that's the
So,
case, you found one of the 1%. That's what I call us, the healthcare
yay.
hygienists. And
Yeah.
we hope that we can
Yeah.
motivate you to want to become that part of that
Yeah.
1% group.
Yeah, I mean, for the hygienist listening, I want you to be elite. I want you to live up to your potential and be empowered to do all the things that you are trained to do. And if you're a patient, which I guess hygienists are patients too, you have to have somebody like this
Mm-hmm.
because otherwise you're just not getting what you deserve.
Yep.
And I don't know about you, but I don't want no half-ass cleaning. You better
No.
give me the goods.
Dude, I want to,
So,
dude, listen to me, dude.
did
I
you just dude me?
dude
Bruh,
you like
bruh.
bruh, like yo. That's the New York in me, yo. Like
Yeah. Sup.
I won't even go to like if I go to an office and they're not ultrasonic in any way, like I won't
Hmm.
go back.
Yeah.
So it's a person
Or
who I still
especially
I want to
I
come to you again.
particularly
There's like
love,
two
yeah,
people I
right,
trust cleaning my
traveling.
teeth and they're not in
Hmm.
Michigan.
Yes, we know the other one. I like her too.
But this one here might sting a
Oh
little bit.
no, what are you about to sting us with?
And
Oh
I
gosh.
don't know. I
Okay,
have a bee on my I have a
you
bee.
do.
Yeah.
Bees are wonderful.
Yeah.
So now we want to say this. We love our patients. We love you guys. We love how you're getting yourself smart, but Google and denial have made things interesting.
Dr.
Interesting.
Google, like if you have
Mm.
active gum disease,
Hmm.
you don't get to vote for a regular cleaning.
I just want a regular cleaning. I
Yeah.
just,
Yeah.
that's,
I just came today for a cleaning. Like I'm not doing that.
okay. Well, good. I think that's kind of like if you showed up to the hospital with a broken leg and you were like, it's okay, just give me a foot massage. That's really all I need. Like, oh, okay. Mm.
And some people get angry.
Hmm.
And I, as you will all learn, sometimes have no filter. But I think sometimes patients, as upset as they might get at the end of the appointment, appreciate the truth that comes out of my mouth
Yeah.
because I didn't give you those 6, 7 millimeter
Yeah,
pockets.
exactly. I'm just reporting the news. I didn't make it.
You know,
Yep. Yep.
that, that's on you.
I
I'm
think
trying to
people are
help
just
you.
more upset. Exactly. I think people are more upset that no one's ever told them about it before. And why is it something new? And then these, of course, are the people who tell us that they brush, floss, they do all the things. And they're like, oh, well, I do have an open mouth. I do have a low vitamin D. And I'm just like, yeah, okay,
Yeah.
this is why we ask these questions. So
And
I don't
although
know.
you know when they say I just want a cleaning, like it's cute,
Mm.
but it's not medically appropriate.
It's a it's adorable. But what people need to remember is after we've done our assessments, if there is infection and bone loss, it is literally our responsibility and our job to present this and to treat the disease appropriately.
Yeah, we're not to make everyone comfortable at the
Hmm.
expense of their health. Like I'm not,
Yeah, that's true.
So we do also
Yeah.
have a license to maintain, and there is not
Hmm.
one person out there that is worth me losing my license.
That's true. I mean, and I think maybe one of the things that we don't get to learn enough about in school is these kind of difficult conversations that we have to have because we learn on these people who know that they're there in the chair. And then as you assess these, and sometimes you can catch yourself being like, oh no, Mrs. Jones has a bleeding 5 millimeter pocket. And we are assuming things for them. And we just have to remember we are their healthcare hygienist and we have to have these difficult conversations because they deserve the best health and we are not here to make those decisions
Yeah,
for them.
and we're not
Mm-mm.
upselling. We're
Mm-mm.
not
No.
car like used car salespeople. Like I've had
Yeah.
people say to me, and I'm just like,
I
you
think
know,
that's somebody reflecting back on you, their own discomfort.
because to me, I'm like, you're going to go to the store and buy whatever it is you're going to buy.
Hmm.
We don't even sell
Yeah.
anything in office. I'm just recommending things that are more beneficial for you to
Yeah.
treat your disease.
Yeah. Not
Disease.
only your products and your product list and how to use them, but also the treatment that is appropriate because we're diagnosing and treating what's actually in your mouth, what you presented with.
Yeah.
So,
Because the whole body hygienist, like Lauren and I, we are definitely not there to win the popularity contest. Like yes, I want to, get to know you. I want to have like a good conversation,
yeah,
but at the end of the day, I am there to help you get healthy. And that's it. I'm going to tell you what you need. And if you don't like it, maybe
that's
sometimes
true.
that hits hard, but you have to then figure out, okay, there's some truth in that because it stirred up some emotions in you. So, like, how are we going to fix this? We are part of your team. Like, we are there to help you get better.
That's true.
But
This is where,
if there
oh,
was an award
ah,
for the most times explaining why bleeding is not normal, who
we'd
would
win.
win?
Hygiene, hygiene. I think, I won the superlative in high school for the most class spirit. So, if you didn't know, I was a cheerleader. So I was a cheerleader. I won the most class spirit. So I tried to bring that into the operatory. So even though you think I'm trying to do all these mean things, and you think dental hygienists are the meanest person on the planet, I am your cheerleader, and I am cheering you on.
Me and Lauren had this conversation yesterday as I was going through my garage. We don't, you don't want to know what I won.
What did you win?
Well, it's
Would
not
you
as
like to
cool
share
as you,
that?
like biggest
It's way
spirit or
cooler.
like, oh, I won the biggest flirt.
I think that's cooler, actually. I mean, although I was head cheerleader
My
and
parents
whatever.
must
But
have been so proud. These immigrant Greek mommy and daddy. They're like, look at my daughter.
they probably didn't
Biggest
even know what that
flirt.
meant.
No clue. Well,
Yeah.
my mom, no clue, but
I appreciate that you won. See, you stood out in a crowd. And so here you are just flirting with dental health.
that's
Here,
right.
let me flirt with your tartar.
Yeah.
Yeah.
Oh, I like we both said that at the same time.
Oh, that's awesome. All right. So,
So much we have to say.
you
There's like
know,
so much we want to
yeah,
say. This
right.
could be
It's
like a
true.
full like 3-day episode of
I don't
nonstop
know how we ever
Lauren and I
keep it under an
talking.
hour. I don't know. Okay, squirrel. What I get upset about and what I really want this episode to be about is that most people have never had anyone clearly explain what is happening in their mouths.
Yep, this is true. We have plenty of examples. They're just been told they need a
Mm-hmm.
deep cleaning.
Mm-hmm.
And Laura and I were talking yesterday, and it's like I've seen so many patients where they come back for their non-surgical periodontal therapy, and they're
Mm-hmm.
like, I don't have periodontal disease.
Mm-hmm.
And then I'm like, well, here we go. Now I have to explain, pull out the x-rays. But then I'm like, what are we missing? Because I'm also in an office right now, like I've been there for a year, so a lot of patients never seen me before. We just got the GBT recently there, so it's like new machines, new hygienist. There's a lot of new, and they're
Mm-hmm.
just like. But then I'm like, where are we missing what we're diagnosing,
Yeah. Is
or
that
did they
hard
forget?
conversation?
Because sometimes I do go to the doctor and they start talking, and I go into panic mode, and I just kind of like
You can't
so I
hear
wonder,
everything.
maybe I don't know, but I try to explain it as best I can. I show
Yeah.
pictures. Pictures show a thousand
Yeah.
words, are a
I think
thousand.
it's
So
downplaying. I think that's what we're guilty of because we use the words a little bleeding, a little inflammation, a little like making disease diminutive. You wouldn't say you have a little cancer or you're a little pregnant. Like it's there.
yeah,
So I just, I don't want it to sound like what we're doing is not healthcare. We're not there like pressure washing your molars, guys. We're actually taking care of a disease process.
yeah, we show the people inflammation, but I
Hmm.
also feel that there's a lot of times like people come in, there's bleeding, inflammation,
Hmm.
exudate. I'm telling them all the things they need to do to get them healthy because there's a lot of infection in their mouth, and then the
Hmm.
doctor comes in, does the exam, everything looks great.
Yeah.
And I'm
Maybe
sure we
dentally.
all, and it's like, I just told you that there's, like, there's a handoff. So it's like, are
Yeah.
you listening to what I'm saying?
Yeah.
We need to be on the same page here.
Yeah. And this, I mean, teamwork is important. And I mean, and I think that's why it's important, the intraoral photos. Like, I'm so glad that you do that.
Mm-hmm.
I work in a situation where I don't actually have to do a handoff. My patients go into a whole different room. So I only do hygiene for an hour. And then the next hour, they go hang out with the assistants and the doctor, and they get their x-rays and their exam done over there. So I wrote my notes, I write it on there, and then they follow up appropriately. But
Yep.
because it's definitely frustrating. And I mean, we've showed them the inflammation, we've showed them the x-rays, we're doing all the things, but if we don't have the support, what are we supposed to do?
Yeah, it makes it really hard because that I feel like builds trust. If everyone's on the same page, patients will trust you. If everyone's telling them something a little bit different, like I wouldn't trust them,
That's true.
you
That's
know?
why I think the periodontal charting is very important, because those are real data, real numbers. And although we might be off like a millimeter according to somebody who pushes a little bit harder, but I know you're really good at explaining. So that's good.
They need to understand. I always say them out loud. I tell them, 1 to 3 is healthy, 4 is there's infection. 5 or more is periodontal disease. Bacteria is getting underneath there, eating your bone. So I feel like a lot of hygienists don't say it out loud from what I've heard. But I think it's very important that you say these numbers out loud because then they hear them. Because now all of a
Yeah.
sudden, if it's 323, 425, 8, 9, 10, they're like, oh,
Yeah. What's that? Yeah,
it
exactly.
goes to 10. Yeah, it goes to, we don't know what number that is.
It goes to the bend in the probe. See, and I think that's where I always enjoyed when I worked in an office that had like the digital probe that you would read into, and then we would have it on the speaker, and then of course it would be like alert, or it would give the little
Do you
scary
like
things.
that? Because we have it. I never use it. I feel like it takes longer to use that for me than it does just probing.
Well, yeah, but once you get used to it, I mean, it adds like 45 seconds. It's really, but I think that it's the same as us because I do my own perio charting. And so I
So do I.
feel like, I can reach back and click, 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 but then I'm not as good about reading it out loud.
Yeah,
I would rather have an assistant in the room, but
yeah.
I don't
Because
get that.
the only time I really would like help with probing is when I know it's severe perio and it's not just 323 and there's like a
Yeah.
systematic approach in my head of how I do it. But when it's like
Yeah.
7, 8, 9, 4, 3, 6, 9, 12, and
Yeah. Yeah.
11, I'm like, oh my
Yeah.
God.
Yeah, exactly. If it is our prophy patient who has a pattern, that's fine. I can do that with myself, especially the day they come back from like after their 6-week recall. That's when I want the most
Yep,
appropriate.
yep.
But yeah.
But,
And
well, go ahead.
I would say we're trying to connect it to the real thing. We're
Hmm.
trying to connect it to the human in front of us. So,
Absolutely. Because your bleeding gums, it's a response to a bacterial infection. And I tell all my patients, like, if you're coming back every 3, 4, 6 months, and we've made some changes, but you're still bleeding, there's still inflammation, why is your body not allowing you to heal? There's something's happening.
yeah.
And that's where I'm just like, okay, what do we do?
Yeah.
And I
This is
think we're
where we
going to
start
have a
asking
whole other
questions.
episode of
Yep.
like, what do we do? Because I think a lot of us don't know what to do
Yeah.
from there. Like, who do we refer to? Is our doctor
Yeah.
in alignment
Yeah.
with us? Do we refer to like, sometimes I tell patients, because a lot of men especially don't even have a primary care. So I'm like, when was your last blood panel done? Like your inflammatory panel, never. I'm like, well, you
Yeah.
need to go. We need to establish a baseline. But that's a whole other conversation because I don't trust half of the numbers that they tell you are all
That's
normal
true.
because we as
Yeah.
Americans are an unhealthy population, so our
I
averages
don't
are
want to be
very skewed.
normal.
You know,
Absolutely. I don't want to be
so
compared to the average American. I'm just like, no, I don't want my A1C to be 9 and my doctor tell me that it's fine. So I also don't understand why so many of these physicians don't, maybe because they don't care, but whatever. They don't inform clients, their patients, and our patients that a lot of these medications cause dry mouth. And then this dry mouth is then why you, Joe Schmo, come in and I'm just like, oh, look at this film. Look at all these x-rays. Look at all these things going on in here. But no one ever told you that your mouth was going to be dry.
mhm.
So,
So then
yeah.
it's like that fine line of is it an airway issue? Is it
Yeah.
medications? What is it? You know,
Yeah.
and
That's why we ask the questions, people.
mhm,
That's why we ask. So, yeah.
yeah. But instead of feeling blamed, like no one changes because they were shamed. That's for sure.
Mm-hmm. It's true. But they do change when things make sense. They make sense, and we've connected the dots for them, because I think that's one of the things that I often say is I think everybody knows what they should do, but nobody knows why. And as soon as they know why, that's when it's like, oh, okay, we're going to like actually connect the body and the mouth. And so I think this is where things can actually get really interesting for us as providers, but then also for the patients.
Exactly. I agree with that because the mouth is not an isolated cave that's disconnected from the rest of your body, okay?
Some
It
caveman
is.
coming out.
I did enjoy swimming in a few caves. Well, not real caves. I would be terrified in Greece, but yeah, the
Mm-mm.
whole body is connected.
Mm-hmm. Yeah,
It is
it is.
one. It
Yeah,
works together.
yeah.
Each
It's a whole
system,
system, people.
it's like
Yeah.
they
Mm-hmm.
communicate
Mm-hmm.
to each other.
Yeah. That's what I will say, it's like a lazy river, right? So if you have bacteria and you have something going on here, it's not just going to stay here. Oral bacteria does not know that it's oral bacteria. It just knows it's bacteria and it wants to be free, just to go all through the body there. Yeah.
Yep. It's
It's a whole system.
system. And mouth breathing can affect sleep. It affects development, overall health. And
Hmm.
you know that. If anyone knows that, Lauren knows about mouth breathing.
That's true.
That's
That's my favorite. Oh, and it's funny. Not only do I notice it in every patient, every person that's ever been around me, I am only 5'1". So my eyeballs are like mouth level with people. So I get to experience the effects of open mouth, nasty periodontal disease as like this constant wave that I walk through. I was at the gym this morning and I had to get off the treadmill next to me because the person next to me had so much perio, it was funking me out. I was like, ugh, here's my card. Ugh.
yeah.
So,
That was me on
yeah.
the trains in New York.
Oh, the worst.
There'd be, well, I would just want to tell people, like, just stop talking. Shut your mouths.
Shut your mouth on this
It's
toothbrush.
like it was so,
Here.
it was
Yeah.
intense. Like I made my ex, like he could then smell periodontal disease. I had trained him. And he'd come and
That's
be
good.
like,
He's like a bloodhound now.
yeah, yeah, pretty much. So
That's funny. Um, Man, do you have people who kind of don't understand when we tell them that the connection with sleep and everything, that poor sleep can actually cause clenching and grinding, acid reflux, cravings, strange mood issues, and other healing problems?
a lot of them don't put it together. No one's ever
Oh,
explained these things to
no.
them. And,
Mm-hmm.
our job is to do that. And sometimes I try to
Mm-hmm.
break it up because it's a lot to go over everything in one
Mm-hmm.
appointment. So I try to pick like the most important thing, kind of focus on that next appointment, go over that something else.
Mm-hmm.
But
Mm-hmm.
it's dry mouth like really dramatically increases cavity risks. I am so tired of
Mm-hmm.
everyone saying brush more so you don't get cavities. And it's not always that, guys, especially
No.
being that we do disclose and these people have recurrent decay or a lot of decay, just their high risk decay, but
Mm-hmm.
there's really no biofilm,
Mm-hmm.
then it's not that.
Exactly.
So
And that's
it's
why disclosing is
so
wonderful.
important.
That's why that triplaque is a wonderful thing, because I love it that we can actually say, here's the mirror. Let me walk you through your habit, your habitual brushing and flossing pattern. And I love it when the people are like, listen, I brush, I floss, I water pick, I tongue scrape, I use the interproximal brushes, I do all the things. And yet I still have teal all around, or especially on the tongue in there. And I think that is our best tool. I genuinely wish every hygienist listening would start using disclosing agent again. Although it's hard because if you don't have an airflow system, you can't get it off. But I think even if you did it every once in a while, just to kind of reset. And also, people, it is available on Amazon. You can always just tell people to get this stuff and use it at home. But PSA, if you have white porcelain sinks, do not spit those red disclosing tablets into your sinks because it will dry it out.
Yeah.
So,
Good
anyway,
point.
you're welcome. Did you know nutritional deficiencies show up too?
Yeah.
And when people come in and they talk about like burning tongue, frequent canker sores, ulcers, delayed healing from when they do lacerate their gums, that can all be nutritional deficiencies. And we can see that in the mouth.
Yeah, because your mouth is often one of the first places the body waves. I wanted to make a red flag for today's episode, but I didn't have time. Your body
Oh.
waves a red flag. It's like distress. Help
Help,
me.
help, 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 help. We need to just be the floaty
I'm
guy
on
thing.
fire.
Yeah,
Fire.
right? It's on fire.
Yeah.
So, and of course, we are the people who are just cleaning your teeth, but we're the ones who are staring at it and we're looking directly at it. And so, you know,
And now
what tells us a lot.
it's the mouth. Literally, if you it says so much. It really
It's
does.
true.
But right now, I think we're going to dive deep into Lauren's segment of airway.
Airway. Whoop, whoop. This airway is interesting, right? I start talking about airway and it either makes people glaze over or become obsessed because people then start, like you right now, you're like, oh my gosh, all these things I have to start thinking about. So I don't know. It's fun to get people to start to think that things could be different.
Yep, yep.
You know, I like the obsessed.
When do you think that? Because I feel like it's newer in dentistry, right? Like, when do you think it started becoming more prevalent now that we're starting to talk about it more? We're starting to see the connection more.
You know, genuinely, I think it was COVID.
Yeah.
I think COVID is when people in dental and airway really connected everything.
Yeah.
Although, gosh, I mean, myofunctional therapy has been around and airway has been around. We can think about Weston Price and, you know, what he talked about 100 plus years ago. And so but I genuinely believe that the general public got more interested. I hate to say it also, TikTok and social media have really, really pushed a lot of this stuff. And I think it's for the wrong reasons because these kids who are doing like the jawser sizing and they're trying to like max their face or whatever they're doing, it's inadvertently helping people understand more about airway. And then people come in and ask more questions about it. So,
That's
but
interesting.
I mean, I started down the airway path because I wanted to know more about sleep apnea. And the office I was working at in Chicago got into like the somnomeds and the tap devices. And so that really that struck my curiosity. And that's been 8, 9, 10 years ago. So,
That's Yeah, I think COVID woke up a lot of people
mhm.
in different, like, that's where I feel like the oral systemic connection started to kind of
Yeah.
get more
Yeah,
involved.
people
But
just got interested. They
yeah,
were like, oh, if you're going to be sticking a tube down my throat, it better not be full of disease.
but if you're
Yeah.
snoring, grinding, waking up tired, I'm starting to talk about myself. I feel like right now, I don't snore all the time, guys, but apparently it's a thing sometimes.
Listen, this is what you're doing right now is very important because this is not a social thing,
Mm-hmm.
people. When I ask you if you're snoring, you don't, it's not to embarrass you.
No,
It's not to be some sort of like judgmental thing because I feel like people feel like we're asking them if they kick puppies for fun or
right.
something. Like, no, I'm asking you, has anyone ever told you you make strange noises at night? Clenching,
Sometimes. Yeah.
grinding, snoring? Do you flop around? Do you punch people? Like, these are airway signals. This is why we ask those questions. Please don't be embarrassed.
Yep.
Please don't think I'm accusing you of being anything except for I'm just trying to help you breathe.
Yep.
Like,
Trying to save your life. And this
yeah.
is why sometimes I'm on a plane and I'm like, damn it, I don't want to fall asleep.
I
Because
ha-
what if
I
I start snoring?
It's
You
okay.
know
You
what?
won't
Who
snore for long.
cares? Whatever.
Yeah. Because you don't know the person next to you.
I
So,
also, my boyfriend said that when I sleep, I put up like a shark fin. I have a shark fin situation where I like this, and then I like push down, and then he has, and then I, what is that? Could
that's
also be a
interesting.
dance move. I don't know, but
Is that the sprinkler in your
something's
sleep?
wrong with me. So I feel like my
Is
airway,
that your red flag? That's your flag. It's not a shark
what
fin.
is
It's your
happening?
flag.
But I
That's your
see
body going, what is this? Yeah.
90% of the population has undiagnosed airway issues.
Correct.
And in that
Well,
90%, I feel like I fall in that tube. And that's why I want to do the sleep test because I
mhm.
refer my patients a lot. So I feel like I want to go through that process and see.
Well, and I feel like if no one ever tells them and their physicians aren't telling them, and then we've got people who are on multiple medications, and then of course, my specialty is women's health, and I really focus on the perimenopause and menopause group. And it's like, oh, our hormones are changing, our muscles are changing, and our tongue is not only a muscle, it's 8 muscles, and it has all of these motions. Because you think about all the glorious things your tongue do, and your tongue does. And so it has to go up, down, in, out, around. And this is what's important, because when I look at your tongue and I look at airway, I'm looking for your signs like a scalloped tongue, because that shows me those are the indentations of the side of your tongue going into your teeth, which is a lateral movement. If you have a narrow, crunched palate, now your tongue can't necessarily get up here for a proper swallow. So now you have more, indentations on the tongue. Mouth breathing is going to make you have that white film. Everything is going to get dry. Your papillas are going to enlarge. You're going to have enlarged tonsils. That's going to have a postnasal drip. You're going to have all of these kind of things that are going on. And this is connected to airway. So this is how I connect it with tooth wear, generalized recession. I am sick of providers blaming the patient for brushing too hard.
Oh,
Although
God,
there is a
yes.
component, because I know you've come in and you're being a good patient. And so you go in the morning and you scrub. You are responding to the microfractures that have happened all night long because of the clenching and the grinding. That's what generalized recession is. If there's one tooth that's off, that's fine. But if it's your whole dang mouth, it is not your brushing. It's your airway screaming, people.
Yeah.
And when you have people who come in and we walk you and they've got this like forward head posture, you're literally trying to elongate your airway.
That was me
So,
driving the other day in the car. This poor woman. It was like this, but her chin was so recessed, and I just wanted to like bang on my window and say, "Excuse me,
yeah.
go
Yeah.
get your airway checked."
Yeah. See it
Does
every
anyone
day.
else do that? I screen people as I'm
Yeah.
walking, driving. I'm
Of
like, oh
course
my
you do.
God,
Of course you do.
they have sleep
Welcome to being
apnea.
in dentistry.
Yeah.
It's like every time we ever have a friend who's like, I don't want to come to you. I don't want you to know I don't floss. I'm like, don't
Yeah.
worry. I assessed your mouth a long
Yeah.
time ago. So,
But
you know.
we're not diagnosing sleep apnea.
No, we're noticing.
Yeah.
We're screening. We notice and we screen and we refer, because we are collaborative healthcare hygienists. And that's what we do.
Yeah, because untreated sleep issues affect every aspect of health. When you're
Mm-hmm.
not nasal breathing, your body can't convert nitrates to nitric oxide, which you need for
Yep.
vascular health. So you're going to have
Yeah.
heart problems, high blood pressure, AFib.
Mm-hmm.
I can go on and on. That's just one portion of one thing, because of diabetes, dementia. I'm sure
Mm-hmm.
Lauren can go on and on about this topic as well. So,
Yeah. Well, and I think we'll touch on it again, but I really want to just remind people there's no amount of stimulant or coffee or positive affirmations that can outwit or outdo or undo actual oxygen deprivation. Your tongue is choking you out at night, however many times an hour, and somehow we sort of think it's normal. So,
yeah. And I get a
I don't
lot of
know.
patients, and I'm sure, well, I don't, you work in a biological office too. So, so many patients tell me, no one's ever told me this before.
Mm-hmm.
Or no one's told me before, and like it's making sense.
Yeah. Yeah, that's what the explanation is.
Yeah.
And for me, I think it's rewarding.
Yeah.
I'm grateful to have been the person who has been there to be able to do that.
Yeah.
But I'm heartbroken. I'm heartbroken that these people have lived this many years and they haven't been to the right provider. So I am happy that they finally get to come to us.
I will
So,
say though, there's a lot of, since moving to Michigan, where I feel like a part of, and it's not just Michigan, I think it's the Midwest and maybe some southern states where I feel like it's a little bit prehistoric in the way they somehow do things. But I do
it's the
feel,
it's the US.
is
It's
it?
not just
Okay.
state by state. I mean,
Maybe we
you know
just
how it is.
been lucky and worked in some really great offices.
Correct.
So,
We don't, because we're not chat and polish
yeah.
hygienists, so we won't just settle for that. Like, you and I have walked out of offices. We've been like, I'm not doing this.
But I will say, like, a
So,
lot of the patients I see here are already either like they're on a CPAP, someone's already
mm-hmm,
talked to them about it.
mm-hmm,
There's a small portion where I'm like the first person that's ever told them anything about it.
yeah,
But it's nice to see that. I'm asking them all the questions, and they're like, yeah, I have a CPAP. And I'm like, yes, yay,
yeah,
you. So
You're
happy.
like, and
Who's
then
your
has anyone
doctor?
talked to you about exactly out about all the other stuff? Well, and I think there's lifestyle components to that too, right? So I live in Vegas. It's a lot more outdoorsy. It's like the California avocado, rollerblading people aren't going to have sleep apnea. But this is the fallacy, right? So if we think we're in the Midwest, we're going to have our big sausage and beer drinking football fans who are all overweight or,
Hmm.
hibernating in the winter. I don't think that's the truth. And this is where the problem lies, is that all we've ever studied is overweight, middle-aged white males who have basically like drink and smoke their whole life. And those are the ones that we base all of our sleep apnea studies off of. Like, no, I'm telling you, the number one diagnosed patient for me right now with sleep disorder breathing are tiny women,
Really?
tiny middle-aged women.
Really?
Somebody who you would never look at and go, that chick probably snores or she has sleep apnea. But because of hormonal imbalances, and just because also, if you and your boyfriend showed up at your primary care physician and said we have the same exact symptoms, fatigue, clenching, grinding, all of these other things, acid reflux, even such, they would put you on Lexapro and they'd give him a sleep test.
Yeah.
And that's frustrating. Like, why are we aren't tiny men. We don't need to be treated but whatever.
I feel like a
Anyway.
lot of things are missed, especially I guess if it's tiny
Yeah.
little women, you know,
Yeah. Yeah.
things get
But
missed,
see, yeah,
overlooked, and then it's like a lot of times like just because you don't snore doesn't mean you don't have sleep apnea.
correct. Well, and also people don't realize that, because people will say, how do I clench and grind and snore? Well, because it's a cycle, right? Also, you can do a palatal flutter. I can snore with my mouth closed.
Hmm.
See, that's also an obstruction. And so that's going to make a really good short later.
Yeah.
It's going to be something that people don't think about. And I'm like, listen, you can clench, you can grind, you can have a dry mouth, and you can absolutely snore. But, when you find the root cause of all of that, everything can begin to change and we can start working on your gums and make those improve.
Because I
So,
always tell my patients too, like if you're coming in with inflammation and your root cause is airway, it doesn't matter what we do. I could
yeah.
laser you. I could
Yep.
do whatever it is I want.
Yep.
It's not going to fix a problem. So I'm not even going to laser you because to me, I'm like, I'm not going to have you
Yep.
waste money. Get the root cause fixed. So
Correct.
then we can start addressing everything else correctly.
Correct. Yeah, absolutely.
You know?
I mean, I think we're addressing the root cause. So your gums will improve automatically. You're going to get your sleep to improve. Your energy is going to improve. And
The whole,
what do you think?
I feel like just your health trajectory as a whole is
Mm-hmm.
going to improve.
100%. 100%.
Breathing is very, I'm not even going to say, oh, breathing's a little important. Breathing is very important.
It's literally the most important thing you could do. So I tell people that every day. I'm like, please keep doing that. I want you to do it
I
even
had a
better. So,
patient with an AHI of 96, oxygen desaturation of 52. How? I don't even
whoa.
know how he's alive. I
How
didn't
is
even
he
know.
on a
I don't even know
CPAP?
how you can. He is now, and he's like, it's life change, like a huge difference. But I'm like
Wow.
52% deoxin, like I can't even deoxin.
He would have been on a crash cart in a hospital.
Yeah,
Like, that's unbelievable. So
I just
all
didn't know.
this is
I
to
didn't
say,
even know
people,
that you can go that low, 52%.
I didn't know you could walk
I'm
around
like,
like
is your
that. That
brain
feels
still
like,
working correctly? I don't even know.
could
Like
you
that's
imagine the brain fog?
crazy.
Like, is that what COPD feels like? Is that what emphysema? Is that what, I don't, cystic fibrosis? It makes me feel like it's all of that. So,
Yeah, but yeah,
um, so all of this is to say that your healthcare hygienist do not just clean teeth.
no.
Nope.
We don't. We
Mm-mm.
assess, we educate,
Mm-hmm.
we connect the dots. We want to
Mm-hmm.
advocate for you guys, help you advocate for yourselves. So,
Mm-hmm. Yeah. I mean, you and I are screening for disease, inflammation, airway dysfunction, nutritional issues, and systemic health concerns in general.
all before lunch in a
All
mask.
before lunch, exactly. And also, while we're probably skipping our own bathroom breaks,
Yeah.
skipping drinking water, which gives us dry mouth, so that's why I like my Xylamelts.
Yeah.
And then, also kind of pretending that our hands and our back are fine.
Yeah.
You're
As we're
welcome.
stretching in the hallway.
Yeah, that's true. I
You know,
do like
this, what?
the stretches.
I do.
Yeah.
Yeah, I do. Yeah. People must think I'm crazy, but this isn't being extra, guys. It's not.
Mm-mm. No, it's the way it should be done. This is what we should be doing.
And I feel like once you experience this kind of care, like, I don't know, you realize dentistry can
That's
be so
when,
much more
yep.
than
Yeah.
just a polish and toothbrush sample. We don't even have toothbrushes.
I don't either.
No.
I don't either. Because I
Patients
want to
get
focus
so
on that.
upset, and
So
I'm like, you could get an electric. Clearly, you need
get
one.
whatever you want. Yeah, exactly. So hopefully this episode made you, your hygienist, you as a hygienist, and you as a patient look at your dental visits differently. And if it did, would you mind sharing this with a friend?
Yes.
Or with your dentist?
Yes. We like to stir
Share
the
it with the
pot
people.
responsibly. Because I feel like it needs to be stirred.
It's true. Stir it up, people.
You know?
Stir it up.
We did this in under an hour.
This one could have gone longer. So let's wrap this up. We're going to say thank you for listening to us, Tessia and Lauren,
Thank
and
you
the
so
Unhinged
much.
Hygienist. So
thank you for your
you know,
support, your love. If you have
Yep.
any questions, comments, concerns, if you want to, please share this with everyone. Follow us on the Unhinged Hygienist, Facebook,
Yep.
Instagram. We're on all the platforms. Our Beacons account is on the Instagram page.
Yep, you have access to all our stuff. You can find us on multiple platforms because
Sweet.
we're out there trying to help you as much as we can, and we're out there having one awkward gum and airway dental conversation at a time. So
And I can be a little aggressive, but it's because I'm so
passionately aggressive. I am passionately aggressively telling you we're done here.
We're done.
Have a nice night.
Thank you so much.
Bye, everyone.
Bye.
Mwah.